Until recently, hypothyroidism was not widely known, but now the situation has improved, although many people still unknowingly struggle with it. Therefore, in this video, I will give you an insight into the symptoms that may indicate hypothyroidism as well as Hashimoto's disease, as this condition often leads to hypothyroidism. To better understand this topic, namely the symptoms of hypothyroidism, I will briefly explain why the thyroid is so important for health and why its disturbed functioning causes so many symptoms. In short, the thyroid is responsible for the production and release of hormones such as triiodothyronine and thyroxine, which are abbreviated as T3 and T4. What is important is that these hormones act on many cells, tissues, and organs of our body. It would not be an exaggeration to say that the thyroid gland has an exceptionally wide influence on metabolism, more so than any other organ. Specifically, thyroid hormones stimulate metabolism and speed up the changes that take place in the body. For example, thyroid hormones increase the strength and speed of heart contraction, accelerate the pulse, increase heat production, intensify bone reconstruction, stimulate the nervous system, thus sharpening our alertness, improve intestinal peristalsis, regulate reproductive functions, including regulating the ovulatory cycle and spermatogenesis, as well as affect the growth of hair and nails and the condition of the skin. In the case of hypothyroidism and Hashimoto's disease, which usually leads to hypofunction of the gland, there is a decrease in the levels of the mentioned hormones. As a result, all the processes I have just mentioned slow down. One of the symptoms of hypothyroidism is a feeling of chronic fatigue and exhaustion. I must emphasize that this fatigue really takes its toll and does not even go away after rest, including sleep. People with hypothyroidism often have difficulty performing basic everyday tasks. This is partly due to the fact that in hypothyroidism, metabolism slows down, resulting in less energy being produced, which leads to increased fatigue and loss of vitality. Furthermore, these patients often report feeling sleepy during the day. The consequences of a slowed metabolism, also known as a reduced metabolic rate, are a constant feeling of cold and a decrease in the energy transformations occurring in the body, which is associated with a reduced heat production. As a result, people with hypothyroidism are often cold and tend to wear sweaters or jackets when others are wearing short-sleeved shirts. As I mentioned at the beginning, thyroid hormones accelerate intestinal peristalsis. Therefore, if they are lacking, the functioning of the intestines slows down, resulting in recurring constipation. Of course, diet plays an enormous role in dealing with constipation, but in the case of a thyroid disorder, even with a diet rich in fiber and containing the proper amounts of fluids, we may still have problems with constipation. People with hypothyroidism may also experience increased hair loss on the entire scalp, leading to thinning. It is important to note that this problem usually appears a few months after the onset of the disease, as it takes several months for the human hair cycle to develop. Additionally, people with hypothyroidism may report hair loss and thinning of their eyebrows. Symptoms of hypothyroidism also include skin problems such as dryness and sensitivity, as well as a tendency to flake. Additionally, some patients experience decreased sweating. This is due in part to a deficiency of thyroid hormones, which leads to a decreased secretion of moisturizing substances by the sweat glands. Due to a slowed metabolism, which is a result of a thyroid hormone deficiency, people with hypothyroidism experience an uncontrolled, unplanned increase in body weight while maintaining their caloric intake. That is, with hypothyroidism, our bodies do not make full use of the energy supplied and, simply put, store it as fat. In addition, during this condition, water retention in the body occurs, which also contributes to an increase in body weight. As a result, people with hypothyroidism often struggle with being overweight and obese. Referring to water retention in the body, I will mention that this not only affects our body mass but also causes swelling, mainly in the lower extremities and facial puffiness. Namely, with a lack of thyroid hormones, our kidneys filter blood less effectively, resulting in fluids accumulating in the body. What's more, with poorly functioning thyroid, circulation problems arise, exacerbating the aforementioned problem. Additionally, with the lack of thyroid hormones, certain substances called mucopolysaccharides are deposited in tissues under the skin, which absorbs fluids like a sponge, intensifying the appearance of swelling. In cases of hypothyroidism, there is often a decrease in blood flow to areas of the brain related to memory and concentration, which in turn has a negative impact on our cognitive functions. To be more precise, people with hypothyroidism have difficulty with memory and report concentration problems, sometimes referred to as a brain fog. A lower level of thyroid hormones also results in a decrease in the quality of sperm, since the process related to sperm production then occurs. Furthermore, literature data indicates that more than a half of men with hypothyroidism have problems with erections, and sometimes delayed ejaculation is observed. All these factors contribute to decreased fertility. When it comes to women, we often find menstrual disorders that are linked to a decreased production of hormones responsible for the menstrual cycle due to a thyroid hormone deficiency. As a result, women with hypothyroidism may experience, for example, irregular periods or even the complete absence of them. In some cases, very heavy periods can also occur. Other symptoms of hypothyroidism, which I will not discuss in detail, include weakness, muscle cramps and pain, tingling and numbness of the limbs, and an enlarged tongue, hoarseness, a goiter, taste and smell disturbances, a slowed heart rate, and a low mood, including depressive states. If you observe many of these symptoms in yourself, I believe it is worth getting basic tests done to diagnose hypothyroidism. I mean measuring the level of TSH hormone in the blood, as well as free thyroidotyrosine, abbreviated as FT3, and the free thyroxine, abbreviated as FT4. In the case of hypothyroidism, TSH is usually elevated, FT3 is in a normal range or above, and FT4 is decreased. I also encourage you to watch another of my videos where I explain how to improve your sleep, as insomnia and other sleep-related ailments often accompany, among other things, hypothyroidism. To watch it, just click on the thumbnail that appeared on the screen. Thank you for your attention, and I will see you next time.